Right. Well, hello everyone from wherever you're joining us. My name is Leslie Crichton. I'm an anaesthetist based in Scotland, and I'm also Vice Chair of the Board of Trustees of Global Anaesthesia Development Partnerships, or ZADP, which is the umbrella charity which supports ZADP, our Zambia partnership. I want to welcome you all to this online launch of the Zambia Anaesthesia Development Partnerships Impact Report, whether you're joining us live or whether you're watching back the recording at a time that suits you. Over the next hour, you're going to hear firsthand from both Zambian and international members of ZADP about what it's like to be part of this project and the many ways in which you can support us. But first of all, I want to welcome our chair, Professor Dylan Bould, who'd like to say a few words. Over to you, Dylan.
Thank you very much, Leslie. Excuse me, I'm a little bit congested at the moment, so excuse me if my voice sounds a little strange. Thank you very much for coming to everybody. I'm always really excited by the launch of the annual ZADP Impact Report because it's always such an amazing document of how much work has been put in and how much has been achieved in the partnership year by year. And for sure, this year is no exception. So I'm really, really delighted to welcome you to the launch of the Impact Report. I'd really like to thank everybody who's been involved in not just putting the report together, but doing all of the work that's detailed in the report. So just a ton of people on the ZADP committee in Zambia and internationally who've really given up many, many hours of their own time to really keep this partnership as amazing as it is year by year. So thank you so much to all of you for all of the work that you put in. It's really very much appreciated. You're going to be hearing more about the specific impacts this evening throughout the rest of this hour. And I really hope that you'll be inspired by what you hear and go away and read the report in detail because it's really a very impressive account. And in fact, if you haven't, just go back and read the previous years as well, because it really is amazing work done year on year by this partnership. You'll hear also, and a lot of people often ask about how you can support the partnership if you're not already involved in volunteering. And without trying to do a hard sell, there's definitely opportunity to contribute financially. In particular, we're really, really encouraging people to give a monthly donation to GADP, no matter how small, so that we have a more regular flow of income that we can really use for anything we want, especially things like admin support that are really hard to cover from grants. It's really important to have some kind of regular income to cover that, which is so important to keep these programs running. So if you're impressed by the work that you hear about and you want to know a way to contribute, please consider just a very, very small donation month by month. It would make a huge difference. So I'm going to hand back to Leslie. Thank you so much for the chance to welcome you. And on behalf of the board of GDP, thanks to everybody involved in the ZADP partnership who's done all this great work.
Thanks, Dylan, and especially for joining us when you're not feeling well. It's much appreciated. Before we hear from our first speakers then, I just want to go through a few little bits of information. First of all, please make sure that you're muted at all times, just so that our speakers can be heard properly. If you have any questions, please type them into the chat. Don't ask them out loud. And what we're going to do is keep all of the questions until the end of the webinar, and then we'll invite all of the speakers to come back and join us as a panel, and we can address any of your questions then. But do type them in as you go along, and we'll keep an eye on the chat. At the end of the launch, we're going to share with you a link to our impact report, which you'll also be able to find tomorrow on our website and all our social media. I'll send it out by email, also with a link to a recording of this launch, so you can either watch it back or send it on to other people who perhaps weren't able to make it live. There's also a link to our website in the meeting chat as well, and to our impact report, so you can find all of those links at the side of your screen. You'll be hearing later, as Dylan said, about some of the ways that you can support us. And as Dylan said, one of the easiest ways is to consider signing up for a monthly donation or a once-off donation, just whatever you can manage. And there is a QR code at that side of the screen, which will take you to our Just Giving page where you can do just that, and also a link to the Just Giving in the chat as well. So let me introduce our first speaker. Our partnership works really closely with the Society of Anaesthetists of Zambia, or SAS, to make sure that we're directing our efforts to the right things and also addressing Zambia's priorities. So I'd like to introduce to you Dr. Matt Kalenga, who's a final year anaesthetic trainee in Zambia and also a member of the SAS Executive Committee, to tell us about some of the challenges that Zambian anaesthesia is facing and some of the ways that Zed recorded his talk for us, because the power situation in Zambia is really challenging at the moment. But he's also been able to join us live, and we're hoping that he'll be able to join the panel at the end to answer some of your questions. So I'm going to pass you over now to Dr. Kalenga. Thank you.
Good evening, and thank you for having me. My name is Mac. I am a pediatric anesthesia fellow at the University Teaching Hospital in Lusaka, Zambia. And it's an absolute pleasure to be here. I wasn't quite sure where to even begin with this talk when I was first asked to do it. But ZADP has been such an influential part of my training and professional development. And so I'm absolutely honored to be able to be here to speak at the launch of the Impact Report. And so I'm going to get right into it. I want to talk a little bit about what I see are several barriers to safe surgery and safe anesthesia in Zambia. And one of them that I think is quite critical is equipment and infrastructure, and the unavailability or the lack of proper maintenance of anesthetic equipment, all the way from anesthesia machines to patient monitors to ultrasounds and advanced airway equipment. I think you will find a wide range and wide variability in availability of this kind of equipment in Zambian hospitals. And so a good stable supply of this equipment, as well as proper maintenance of it, is really quite critical to safe practice. And the same can be said about medications. The supply of medications for anesthesia is really crucial to safe practice, and you can see some variability in availability of even things such as local anesthetics for regional anesthesia, opioids, neuromuscular blocking drugs, and reversal. And so stabilizing the supply of these, ensuring that they're there across all the different hospitals where they're needed, is really quite important. Another thing that I see as a potential problem is human resource, obviously. In many African countries, many countries in the world actually, the number of anesthesiologists is really not adequate to meet the population demands. And so this is a problem that we have here as well, and I'll speak a little bit more about it in detail. But one of the things I want to talk about is protocols and guidance. I think that it's very important, especially in our setting where we have a number of different anesthesia providers, all the way from people that have no training whatsoever in anesthesia to no formal training, that is, to nurses and physician anesthetists to physician anesthesiologists. We really need to define what the scope of practice is of all of these different cadres, and we need to standardize practice. And the only way we can do that is by setting up protocols and setting up standards for people to follow. With all of these issues, I think one of the most critical ones is the data. We just simply don't have enough data. We're not collecting enough data. We're not storing enough data, and not having a digital system, not having a strong health information management system, I think is detrimental to understanding the kind of mistakes we're making, areas that need improving. Really difficult to do proper audits and quality improvement projects without data. And so I think this is an area that we really desperately need to strengthen. And I think going digital without data is probably the best way to go. Now, coming back to that human resource issue, we know that the WFSA recommends that a country has 5 anesthesiologists for every 100,000 people in their population. At the moment, Zambia only has 0.2 to 0.3 anesthesiologists per 100,000 people. And so we're really quite far off that recommendation. To meet it, we need at least 950 to 1,000 anesthesiologists right now for a population of 20 million. And so it's clear that we have a critical shortage. And it isn't just that we have a shortage, but the distribution of the few anesthesiologists that we have is also skewed. We simply aren't covering the majority of spaces within Zambia. So of the 10 provinces within Zambia, only 4 have physician anesthesiologists, and that's a problem as well. We really do have a critical shortage of physician anesthesiologists. Well, the question is now, how do we close this gap? Well, the simple answer is we train more anesthesiologists. But the numbers are pretty scary at the moment, actually. If we're gonna achieve this goal over the next 20 years, we have to train at least 48 to 60 anesthesiologists every year. And that assumes a number of things. That assumes that the population stays at 20 million and doesn't grow, and also assumes that no anesthesiologists leave the profession or die. And that's just simply not realistic. And so we're currently only training 3 anesthesiologists a year, far removed from that 48 to 60 target. And so the gap isn't just not closing, it's growing. And so it's quite obvious that we have some big challenges here. But I also see a big willingness to overcome these challenges, both from the local teams as well as from the ZADP fraternity. And I think that by partnering and working together, we can overcome them. An area we've seen big gains in is regional anesthesia. When I first joined training, there was virtually no regional anesthesia taking place. But over the years, we've seen an influx of a few portable ultrasounds and ZADP fellows that have regional anesthesia skills, as well as a few locals. And the training of residents in this field has really ramped up. And a number of the residents, including myself, have now the capability to perform independent Plan A blocks, and are not just performing them, but teaching as well. A massive gain. Another area we've seen great collaboration with locals and ZADP fellows is in the area of airway, and we can see advanced airway training and advanced airway skills rapidly developing through the use of video laryngoscopes as well as fiber optic scopes. And this year alone, we've seen a number of maxillofacial cases and ENT cases, which the patients would have otherwise gotten tracheostomies simply because it was felt the anesthesia team wouldn't be able to intubate, and a number of those patients have gotten awake fiber optic intubations. And so we can see some gains in this area as well through collaboration. Another great area in which the partnership has worked really well is quality improvement. And we've seen good partnership between ZADP fellows and local trainees and faculty. And we've been able to collect data and present data, publish data on international platforms. And I'm grateful that I was able throughout my training to collaborate and perform audits and present this data at international conferences like I was able to at World Congress of Anesthesiologists this year. And so I think this is a great area for further collaboration between ZADP and local trainees and faculty. So coming to the end of this, I'd just like to say that it's obvious there's many areas that we could still improve and are really excited to try and improve. There's big mountains to climb, loads of winding roads to navigate, but we're not going to be lacking of companionship because we're doing this together. And I'm really looking forward to the journey. Thank you so much for your time. Thank you.
Thank you very much, Dr. Kalinga. And what really came through for me during that talk was, although there are huge challenges, just the value of collaboration and partnership to be able to help address some of those challenges. Next, we're going to hear more about some of the impacts of ZADP over the last year or so. And I'm going to pass you over next to 4 speakers. 2 of them are ZADP directors. That's Drs. Masuzio Ziambo and Nathan Betteridge, or Nate, who's also a previous ZADP teaching fellow. We also have another previous ZADP teaching fellow, a Kenyan anaesthetist, Dr. Daniel Owambo, and a current anaesthesia trainee in Zambia, Dr. Christian Bagayamukwe. And again, please put any questions that you have into the chat box and we'll move to those at the end. But first of all, over to you, Nate.
Great. Thank you very much, Leslie. Yeah, no, it's been really great to be part of this launch for the impact report. And thank you, Mac, for that presentation. It was really, really great to kind of hear your thoughts and what you feel from sort of SAZ's point of view, how our partnership has been working together, and it's been really well, a privilege for me personally to be part of that. I just wanted to also bring in Masuzio. There's been issues and challenges with power in Zambia now for some time, which does impact the network and other things like that. So we're hoping that Masuzio is able to join us as well. But I'll keep going until I hear from him and he joins the conversation. But as I say, hi, Masuzio, how are you?
I'm all right. How are you? Can you hear me?
I can hear you, and I'm pleased to be able to hear you as well. Yeah, we're delighted to be able to present our impact report to you today. And I wanted to start off, Masuzio, by just telling us who you are and what you do for ZADP, if that's all right.
Thank you very much, Nate. Good evening, everyone. So I'm Masuzio Ziambo. I'm a consultant anaesthetist based at Levy Mwanawasa Teaching Hospital. I'm one of the in-country directors under the ZADP, one of the local directors, and I'm involved in the training program for both the MED and the specialist training program.
Great, thanks, Masuzio. And I just wanted to start off by asking you one question, if that's all right, because we've got a couple of questions, and then we're going to bring in Daniel and Christian. But I kind of wanted to ask you that, kind of based on the impact report that we've got here, there were a number of challenges that have been highlighted in the needs assessment that we conducted last year. And I kind of, again, these have been highlighted by Mac, but with all of this in mind, what do you think, what's been the biggest challenge going forward that ZADP needs to work with local partners to kind of help address?
So thank you, Mark, Nate, and thank you, Mark, for highlighting most of the challenges that I think I was going to talk about. So I'm part of, I come from, my training was under the same program. And ZADP has been there from the time that I think I was in my second or third year of training and up to now. So they've been a partner for a very long time. And I think we've done a lot of great work with them, with ZADP partnership. But one of the challenges I think that we have been facing, I think one of the greatest challenges is the human resource. I think over the years, we've had quite a number of people come through the program and quite a number that have actually left. And one of the things that we have noticed is the workload and the burnout. That's one of the things that I think has contributed to some of the attrition that we have seen and some of the people who have actually not opted not to come to do the anesthetic program. But I think going forward, it's something that one of the things that I think that we need to really advocate for is more people joining the MED program and the STP program. Just have a lot of outreaches to some of the doctors that are actually graduating and showing them some of the interesting things that they could do in anesthesia. I think what's one of the things that we've been trying to look at is to try and get more senior house officers into the to do an attachment in the program. And this is one of the things that I think that we could work with partners to try and get more senior house officers exposed to anesthesia, because I'm not sure how it is in other countries, but here, one of the challenges is that most of our students and doctors do not spend enough time in anesthesia during their training programs, so they don't really know much about it. And so it's a tall order to try and get them into a program that they really don't appreciate the scope. They don't really know the opportunities of anesthetic. And so because we don't get a lot of students in terms of master's program, we see very few people graduating out of the program. And so this has affected the human resource in most of the hospitals. So for instance, we would have 2 or 3 graduates against a number of hospitals that are looking for physician anesthesiologists to not only provide mentorship, but to also help in anesthetic in various programs. So I think one of the things that we really need to work out is to try and improve the outlook of anesthesia to our senior house officers who are the next anesthesiologists.
Yeah, absolutely. No, there's a lot in that as well that we experience here in the UK in terms of exposure to anesthesia, and how that leads to kind of medical students and other kind of junior doctors kind of seeing and being exposed to anesthesia and considering it as a career option. But yeah, no, some really interesting and important insights there that we shall work together to try and address. For the sake of time, I want to make sure we bring in Christian and Daniel. So we'll start with Christian, if that's all right. And it's great to have you here, Christian. And I noticed there was a lovely photograph of you in there with Leslie. And it was great that you've been part of the MED program for 4 years now, I think it is, isn't it? So Christian, if you could come in, Masuzia, I think you've got some questions to ask Christian, if that's okay.
Oh, thank you very much. Thank you very much, Nate. Christian, are you tuned in?
Yes, sir.
Hi.
I'm here.
Good evening.
Good evening to you too, boss.
Yeah. So I just wanted to find out, Christian, what has been your highlight of your training this year?
So this year I obtained a scholarship through ZADP, which allowed me to participate in the 18th World Congress of Anesthesiologists in Singapore, together with Mark and Dr. Chalwe. And I'm really grateful for that. I had to present my work in front of my peers who came all over the world and helped me to enhance my knowledge and experience. If I can.
Thank you.
Yeah.
Thank you, Christian. Thank you for that. Now, Christian, one thing that I wanted to find out is that your training is being done in Ndola, and we know some of the challenges that Ndola has had in terms of anesthesiologists and in terms of the number of anesthesiologists for training. And we've spoken about this in the needs assessment. How do you think ZADP would be able to help you in Ndola, or how has ZADP impacted your training there in Ndola?
Yes, thank you for that, Dr. Ziambo. As you mentioned it, at Ndola Teaching, we only have one consultant. And please allow me to mention his name, Dr. Mbangu, who has done and continue to do a huge amount of work in my training. Being the only consultant, it has always been not easy when we're looking at a different occupation within the department. At some point during my training, I also had help of Dr. Sompwe. But ZADP support has been an indisputable contribution into my training through in-person teaching, online courses. They've been helping me to do certain audit and projects. Yes, as you can see, if maybe the ZADP can testify, once they are in country or they are at our hospital, Dr. Mbangu, he manages effort to release all of us because we are having a few period of time, so he can run all theaters alone, and to let us know, to let us being exposed and get more experience with the ZADP. Yeah.
Thank you for those words, Christian. So for those that are listening and want to get involved with ZADP, what would you say to them?
He or she will be the most welcome, really. Their contributions, experience, and expertise will be a great benefit to us in our training. But also, this experience could help them to learn how to deal with different challenges while delivering anesthesia with limited resources, what we face here.
All right. Thank you very much. Thank you very much for those words, Christian. And I, for the sake of time, maybe we could have a chat with Daniel. I'm not sure if Daniel is on the call.
Thank you.
Yeah, thank you, Christian.
Thank you very much, Christian.
While we wait for Daniel to come on, I had the privilege of, when I was a fellow, being able to go up to Ndola, and it's an absolutely beautiful place, but really great team there who work really, really hard. So thank you, Christian, for you and for all of you up there in Ndola and what you're doing. So yeah, it's really, really appreciated.
Sorry, Nate. While we wait for Daniel, maybe you could share your experience with ZADP.
Oh,
from a UK perspective.
Well, yeah, no, it's an absolutely awesome opportunity, and I've been privileged to be able to go twice out to Zambia as a teaching and training fellow. Not through any, it was mostly because of COVID. I ended up going out twice, but yeah, no, really, really great opportunity, and as a trainee and as an anaesthetist, it really kind of helped develop me, and I've made some amazing friends for life through the whole process. And I tell you what, we talk about kind of going out there and helping train, but I tell you what, I think I learned more than I necessarily taught while I was there, to be honest with you. But I'm pleased to see that we can see Daniel. So I'll just bring you in, Daniel, if that's okay. And thank you for being able to join us. And it was really great to kind of read. There's a lovely bit in the impact report that Daniel's written and about kind of his experience. So we kind of wanted to ask a few more questions, if that's okay. So Daniel, could you tell us how did you find out about ZADP in the first place?
Hi, everybody. First of all, I want to apologize for having to join this call from theaters.
It's life. It's what happens, but thank you.
Yeah, it's life. The way I found out about ZADP was two-part. So one of the consultants at my workplace, which is a hospital called the Aga Khan Hospital in Nairobi, actually trained in the UK. She trained somewhere in Newcastle, and she knew about the program. The second way I found out about the program is just Twitter. I have a list of anesthesia-related activity that I regularly follow, and I think it just really randomly came up in my timeline, and I just applied really from a Twitter link. That's how.
Yeah, and yeah, no, we appreciate that the social media side of things is really important, and being able to kind of reach areas and people that maybe don't have all the sort of links that we'd normally kind of expect via email or via our sort of usual links in the UK, certainly. So no, we really appreciated you joining the program, because that's one of the great things that we've loved, is the fact we've had fellows from within Africa going to Zambia and kind of helping in with the sort of teaching and training there as well. And in the report, you talk about the importance of collaboration and partnership. And I guess my question is, what does that look like practically? And particularly like thinking about ZADP, almost kind of how we could do that better. What were your kind of reflections on that, having read what you've said in the report?
Yeah, so I think practically what needs to happen, at least what I think needs to happen, is one, we definitely, or at least ZADP and everybody, needs to have a bigger presence. Whether that means more social media presence, whether that means more word of mouth, whether that means more research publications. Basically, there's a big part of it that has to do with presence, because that matters for things like funding. You can't discuss this. You can't have this discussion without bringing up funding, because even the fact that I was able to come from Kenya to Zambia wasn't very easy. And a huge part of it was because this was partly funded by my university and partly funded by ZADP as well. So that looks like online presence. It looks like conference attendance. It looks like quality improvement projects that are presented in conferences everywhere, local conferences. The All Africa Anesthesia Conference just happened. So practically, that's what that means. Masuzio earlier brought up that they're trying to get senior house officers, and it goes all the way down to less senior house officers, but even now medical students. So right down to medical school, that's where the work needs to begin. That's what that looks like, in my opinion.
Yeah, no, and you highlight some really important things about kind of having a presence and kind of being seen more, and the importance of funding with that, which is kind of the things we kind of highlighting this evening, just in terms of how people can support ZADP and GADP as well. So yeah, no, thank you for those insights. And I kind of have one more question for you, if that's all right, Daniel. Appreciating you're at work. In the report, you talk about not wanting to have to choose between home and aspirations. And I kind of wanted to ask you what your thoughts are in terms of the benefits of that, and kind of what the barriers may be and how we overcome those to make sure that we're not choosing between home and aspirations, and particularly in your context, and getting other fellows from Africa to be part of the program.
Yeah, that's a very heavy conversation to have. I think
appreciate that you've not got much time.
The argument is two-part again. So the classical argument against, as I said in my statement, choosing between home and aspirations, is whether the classical argument for it is that you gain a lot of skills and you're able to develop yourself professionally. In this setting, especially coming from an African setting and being an African resident, you don't want to leave your setting for greener pastures, because then there's no point of me training to be an anesthesiologist in Nairobi and training in Nairobi my whole life for me to go practice somewhere else and never have to give back. But then you could look at it differently, in the sense that if I leave Nairobi and practice in the UK for a couple of years, if I'm able to channel back either training, if I'm able to teach, if I'm able to inspire more people to come, then maybe I've benefited people back home better. So it's one of those double-edged swords in terms of, do I leave and develop myself, or does me leaving mean potential to build more back home? So it's depends on how you look at it.
Yeah, no, thank you. And you're right. It's a very difficult and tricky thing, and it definitely is a big conversation to have. And ZADP is really has been embedded in Zambia for such a long time, for at least over a decade now, where we have been working to really partner, because I think the key thing is kind of partnership and working to support the Zambian anaesthetists, but appreciating, as you say, Daniel, the challenges there of we've talked already about from a kind of a human resource point of view, and people staying within Zambia, but people have to kind of manage their training and their career as they see is potentially best, but also what supports their families and hopefully Zambia as well in the sort of the longer term with that. So yeah, really difficult but important things to be talking about, and this is all part of the conversation that we're having, and how we want to kind of continue to develop ZADP and support the training and human resource in Zambia. Absolutely. Thank you, Daniel, and thank you, Christian, and thank you, Masuzio, for that. And I want to take the opportunity to also thank all of our fellows who have worked in Zambia for the last, at least in 2023 and continuing now in 2024, for all their hard work. It's really, really appreciated, and understanding that they're taking time out of their own training to do this, and volunteering for ZADP, and it's really, really appreciated. And I'm very honoured that in my role as one of the directors to support and help them as they're out there in Zambia. So no, thank you very much to all of you who have helped and continue to support the program. I'm going to hand back over to Leslie now, if that's okay. But I also want to just say thank you to Emma, who I know is on the call. I have seen her briefly, who is one of the other co-directors, along with Masuzio and myself. And the work that she's done is really, really appreciated, even amidst kind of maternity leave and other things. So yeah, thank you.
Thank you to all four of you. It was fantastic to hear all of those viewpoints, and everyone else will be delighted to know that all four of our speakers also feature in more detail in the impact report. So please do go and have a read of that and find out more about it. So for now, let's move on to how you all can help support ZADP. And who better to talk about that than Dr. Helen Williams, who's a senior anaesthesia trainee in England. She's a recent teaching fellow in Zambia, along with Nate, and is now a very active member of the ZADP committee. Helen has also pre-recorded her talk, but she is also here at the meeting and will be able to join the panel later on for questions. So I'm going to pass over to Helen now. Thank you.
Good evening, everyone. Thank you for joining us here at our Impact Report launch. My name is Helen. I'm a member of the ZADP committee with responsibility for grants and fundraising. I'd just like to start by thanking all the speakers so far and everyone who's been involved with the programme for their hard work and support over the last 12 months. I hope you can see how the work we are supporting is transforming anaesthetic care for patients and improving access to safe surgery. A special thanks to Sonia Akrimi, our outgoing co-director, for her incredible efforts in fundraising to allow this work to happen, as well as coordinating the impact report we've heard so much about tonight. ZADP and our sister organisation EADP work in challenging circumstances to deliver extensive programmes of work that support anaesthetic training and safer surgery in both countries. This work requires tireless effort from in-country partners and volunteers, without whom there would be no programme. However, in reality, there's a lot that goes on behind the scenes to fund and support this work. This talk is to give you a peek behind the curtain of our organisation and our umbrella charity GADP to explain how we make these programmes a reality. So this is me. I first got involved with ZADP in 2022 when I visited Zambia as one of the first in-country volunteers following the COVID pandemic. I'd heard of ZADP years before this and had always had a lot of respect for the way it operates and its partnership model. Since returning from Zambia, I was keen to stay involved in the programme, so I joined the committee for ZADP, and I now have a role predominantly involved with the grants and fundraising side of things, helping to keep the programme running. Behind the programmes of work that you have heard about today is an organisation run largely by volunteers who take the care and progress of the anaesthetic training programmes in Zambia and everyone involved in them very seriously. So what do we actually need to have in place to support this? Well, the first of these resources are people and their time. Our Board of Trustees and the individual project committees are staffed by a mix of medical and other professional volunteers, all with full-time jobs and the normal busy family and life commitments. They give up their time and expertise for free to enable us to ensure we're running the charity and enabling activities that are in line with our aim of making meaningful partnerships, supporting the development of a skilled anaesthetic workforce. The project boards and trustees meet regularly to manage governance issues, discuss funding projections and risk registers, purchase insurance, review accounting statements before submission to the Charities Commission, to name just a handful of their many jobs. To support the projects, there are 2 paid part-time administrators, one in the UK and one in Zambia, who also work tirelessly to keep the show running. They field our inbox, they answer queries, they advertise fellowships, they schedule interviews, they submit permit applications and help with grant reporting, to name just a few of their responsibilities. Without this support, we simply would not have the capacity to continue. With the basics in place, we are then able to hold a competitive recruitment process to ensure we find volunteers with the correct knowledge and skill set to be assets to the programme. As a charity, we pride ourselves on providing our volunteers with pre-placement support to apply for medical licences to practice and visas. They are helped to secure safe accommodation and receive peri-placement mentorship and support with in-country consultants and remote supervisors. We take pastoral care of our volunteers very seriously. The second of our resources is money. Fundraising takes up a lot of our bandwidth, whether that's applying for grants to continue our work or providing regular project updates and financial reports for the grants which we have secured. Funding comes with tight restrictions on what funding can be spent on and rigorous reviews of how we are using the money. This places a large burden on us to evidence that we are meeting our grant requirements. Rest assured, we are always trying to do more with less. Our initiative to provide online teaching through remote fellows is a great example of this. However, our in-country fellows are one area where their value for money cannot be underestimated. In-country volunteers receive a modest stipend to cover part of their living expenses. For our Pan-African fellows, availability of a reasonable living stipend may determine whether it's financially viable for them to participate in the programme or not. The impact report highlights the bidirectional benefits for ZADP and the Pan-African fellows and why funding this opportunity is so important. Funding is also required to cover lots of very unglamorous things, such as the administrative costs of running a charity, our modest support staff, Zoom accounts, accounting software, insurance policies, international bank transfers, and lots of unseen costs without which we couldn't safely or transparently run our project. And the final element is governance. We maintain a risk register and we respond and adapt as the world throws things like global pandemics at us. We have a robust governance structure in place with regularly updated policies and procedures and insurance policies to support and protect our partners and our volunteers. Without this, we wouldn't have the necessary infrastructure in place to keep everyone safe. Again, this relies on the time and expertise of trustees to ensure this is all in place and maintained. We have a website and a social media presence to keep people up to date with our work and to allow us to advertise these fellowship opportunities. These have recently been rebooted with the specialist help and expertise of one of our recent in-country volunteers. She's done a fantastic job with the website and a social media voice, and she's living proof that if you are silly enough to offer to help us, we will take you up on the offer. Our work is heavily reliant on funding from partner organisations such as the Royal College of Anaesthetists, VET, the Tropical Health Education Trust, the Association of Anaesthetists International Relations Committee, World Federation of Societies of Anaesthesiologists, the Obstetric Anaesthetists Association, and many other members in the past. We apply for grants through competitive application processes to secure funding for specific projects, which are set out in partnership with our in-country partners. The Emirates Foundation generously fund flights for our volunteers, as well as some additional ZADP initiatives. For example, earlier this year, they supported the flights of 4 Zambian anaesthetists to attend the World Congress of Anaesthesiologists in Singapore. We also have a Just Giving page, which has received donations for our work, either from individuals or collective donations to sponsored events. Without these generous donations, we would not be able to continue our work. We thank everyone who has given time or money to help us. We've put every penny to good use, whether you've done a bake sale, cycled through the Namibian desert, got competitive with our sponsored exercise from London to Lusaka, or asked your wedding guests to donate to us. We are so, so grateful. In a time where there is a cost of living crisis and spending on international aid has fallen to 0.5% of GDP, Charities like ours face significant challenge in securing funding to be able to continue their work. We all need to diversify where our funding streams come from, and this is where we need your help. Supporting safer surgery is a marathon, not a sprint, and we want to keep up the pace with what we've been achieving in the past. If you've enjoyed our talks this evening, of course we would be delighted if you could donate via our Just Giving page. There is a QR code to follow. And if you can make that a regular donation, then fantastic. But there are other things that you can also do to help. It could be as simple as amplifying our presence on social media. For example, like and share our posts so we get more exposure with the correct audience. Could you run a fundraising event on our behalf? Perhaps your friends or work colleagues would support a quiz night or a cake sale, whatever you're interested in. If you can fundraise for us, please get in touch with us via our website for some supporting materials. If you can help us connect with corporate partners, either in the UK or abroad, if you have connections with big businesses or foundations that can support our vision of making access to safe surgery the norm, we would love to hear from you with your ideas and connections. Or if you have the time or expertise to offer to our committee or our board of trustees, please get in touch. Let us know if you're able to spare even a few hours a month and what expertise you could bring to the table. There's no expectation that you need to have a medical background, just the time and enthusiasm to support our work. Thank you so much again for listening tonight. As you can see, ZADP is such a great programme with incredible energy and the potential to really change lives, not just of the anaesthetists in Zambia and partner countries, but also the wider community at home and overseas in terms of access to safer surgery. If you're interested in making a one-off or a regular donation, please follow the QR code here. Or if you'd like to get in touch with ideas about how you can support our work going forwards, please contact us. Our details are available through our website, which is gadpartnerships.com. Or you can find ZADP on our social media. We have Facebook, Instagram, X, and LinkedIn. Hope you have an enjoyable rest of your evening. Thanks again.
Wow, I thought I had my head around the amount of work that went on behind the scenes for JDP, but that has even surprised me. And as Helen says, money is obviously important, but it's not just money that we need to help support us. Expertise, willingness to help, somebody with a bit of time on their hands, those are all valuable things as well. So if you feel like there's even have an hour a week that you could use to support our work, please do get in touch with us. No offer is too small. Right, so let's move on to some questions now. So first of all, I'm going to invite everybody who's watching to please post any questions that you have into the chat box at the side. And if I can please invite all of the speakers from this webinar, if you're still here, to come and join. And if you're able to put on your video, if you have the bandwidth to do that, then that would be fantastic. But if not, we'll understand. And I'm going to start off with a question for, let's see. I'm going to start off with a question for Christian, if that's okay. So Christian, it sounds like burnout and overwhelm is a big problem for anaesthesia in Zambia, for all the trainees and all the trained anaesthetists. Can you tell us a little bit about how ZADP helps to reduce the workload and the pressure on local anaesthetists, or in fact, if they do at all? Thank you.
Oh, okay. Thank you for this opportunity, Leslie. Really, ZADP has been helpful in our learning and our progression. It's true in Ndola we have been suffering for that. That is really it's true. We need more support in terms of ZADP because having one consultant, it has been very, very, very difficult. Once ZADP is in, it's really helped us because having in teaching one-to-one teaching as well as doing the case together, we learn more and being exposed to different cases. Yeah.
That's great. Thank you so much, Christian. Mac, I don't know if you're around or maybe you've dropped off the call.
I am here.
Mac's left. Oh, you're here. Hi. I wanted to direct a question to you, if that's okay.
Yes, sure. My network's not great, but I hope you can hear me.
We'll do our best. We can hear you fine just now. So you're really illustrating to us some of the different skill sets that we're really developing in anaesthesia, within anaesthesia in Zambia. And I wondered, as the skill set of anaesthetists increases and the number of physicians hopefully increase too, do you feel that surgery in Zambia is becoming safer for patients?
Absolutely. I think the pediatric anesthesia field is an excellent example of that. The introduction of the pediatric anesthesia training program at UTH has seen an increase in, I think, basically we've already doubled our number of pediatric anesthetists in the last 2 years. And that's obviously going to come with improved outcomes. I think the surgeons have been a bigger fan of the introduction of the program than the anesthetists, to be honest, with how popular it is, and that's testament to how training of more physician anesthetists can really improve surgical outcomes.
Thanks, Mac. The next question I'm going to direct to Masuzio, if he's still around.
Hi, Leslie. Can you hear me?
Hi, I can hear you. This one,
right.
maybe this one's
Sure.
an unfair question, because I'm asking you to use your imagination. But let's imagine we found a corporate sponsor with limitless money. If we had limitless money to spend on ZADP in the partnership, what do you think you would spend your money on first?
Yeah, that's an unfair question.
I'm sorry.
Because the problems are so many. I think that one of the things is what I've tried to do is try and reach out to most of the provinces. What we need is a lot more people to come for training, and a lot more. And in that, we would need a lot more people to come support the training. So it would be twofold. Try and reach out to a lot of provinces to try and get people to come for the program. And if that's successful, we'd need a lot more people to help us with training these people. Because one of the things that, Leslie, you've been to Zambia several times. Sometimes I think you're Zambian also, but the times when you have so many theaters that are open and so many students that require supervision, and sometimes it's a little difficult. So we just don't have the number of consultants required to actually supervise. And to be fair to the student, they really require supervision for their own growth, and so that they know how to improve their skills and know where they are going wrong. And most times this is not very possible. So I think that one of the things that I would want is to get more people to come in to help us with training, and see how best we can then get people to get through the training, make sure that we're fostering good values, and have more people come in training. So it would be twofold: get people to come into the training and try and get more ZADP fellows to really help us with training. And I don't know how this would work, is try to get the ministry to actually get them positions. And that's one of the things that I know that this is beyond ZADP, and we've really tried as ZADP to try and get to the ministry to tell them that, we have a lot of attrition, because most times when we have consultants graduate, they're not really placed in the positions that they're supposed to be in. And so I guess we can't really stop trying to engage the ministry. But I think the first thing is to just get a lot more trainees into the program, and get a lot more teachers to come through to actually train these are our trainees. I hope I've answered.
You have. And it's interesting that you mention the ministry, because I sometimes feel that increasing anaesthesia providers in Zambia is a political decision. And I wonder if any of the panel has any thoughts about how we convince the government and the Ministry of Health that anaesthesia is important, because to me that seems like that would result in the biggest gains. I don't know if anyone has any thoughts about that before we finish up.
Yeah, I could come in a little bit on that, Leslie, because this is kind of pointing towards some of the work that we're kind of actually now doing, and looking at sort of capacity assessment in Zambia. And we're working closely with SAS to essentially look at what is the provision of anesthesia in Zambia and what is happening, what is going on, doing sort of an audit essentially of what's the basics of the anesthetic kind of provision within Zambia, and that's across all of the provinces. And it's about, as Mac kind of highlighted in the very start, was data. Knowing what is out there and knowing what is available is the first kind of part of then being able to go to the ministry with SAS, because partnership is all what Zambia is about. It's ZADP is about. It's all about kind of working with our kind of Zambian partners, and we're working closely with SAS to essentially hopefully be able to go to the Ministry of Health and say, look, this is the data we've got. You know, how can we work to kind of improve and give better provision of anesthesia, because we know that improves sort of surgical outcomes and makes surgery safer.
Can I just follow that up with something as well? So I think, as a couple of people on the call have mentioned tonight, actually, I think it's also about increasing the visibility of anaesthesia as a specialty. And I think we find that even here in the UK, a lot, if you ask, a member of the public, what do anaesthetists do? A lot of the time, people don't really understand the role of an anaesthetist in a hospital team. We sort of fly under the radar slightly. And I think actually the more collaborative work that we do as sort of physician anaesthetists as a cohort with surgeons, with other sort of cadres of medical staff within the hospital, the more our visibility and sort of the impact that anaesthetists have on improving patient safety throughout the surgical pathway, the more visible that is, I think the more attention it will be drawn to the ministry.
Yeah, Helen and Nate, that's all so true. And it's great to hear that capacity building project is going on in the background. And I'm afraid that's us running out of time, which leaves me to remind you all to please have a read of the full report, which you'll find on our website, gadpartnerships.com, and to please support us if you can, either by scanning the QR codes and donating some money, or by donating your time or your expertise. Anything is welcome. A huge thank you to you all for coming and for listening this evening, whether you're watching live or watching the recording back in your own time. And to all the people behind the scenes who've made ZADP, the impact report, and this launch happen. It's been a huge amount of work. So go well, everybody, Mwende Bueno, and good night.